The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Susan arrives from China, and Shannon's struggle with cerebral palsy. Two-year-old Susan Zhu is an orphan. She lives in an orphanage in Guilin City in southern China. Susan was born with a hole in her heart and a narrowed artery leading to her lungs, leaving her with dangerously low oxygen levels. Accompanied by volunteers from the Christian Broadcast Network, Susan has traveled to Toronto, where doctors at the Hospital for Sick Children hope to perform open heart surgery that could save her life.
We just have
That's her, right?
Yeah,
Just to confirm?
We have legal guardian.
Okay, legal guardian.
She's an orphan.
Hi, darling. Let me just confirm that's her birthday. May the 1st, 98. Yes?
So, as I explained, the malformation we named tetralogy of Fallot, and that consists of a hole in the heart, in the ventricular septum, and an obstruction of the blood flow to the lungs. And what we have to do is, once to close the hole in the heart and to enlarge the pathway to the lungs. There are certain risks for this kind of procedure. You could be bleeding after the surgery, and bleeding would mean, in a very rare occasion, that we have to look a second time into the chest in order to find probably a bleeding spot.
对，就是胸腔里面有出水，不管是哪个出水，它可能还会打开，找个出水点，然后再记住。就是出血。对，出水。
15-year-old Shannon Carr has severe cerebral palsy. Her muscles are stiff and spastic, which limit her verbal abilities and make even simple movements painful and difficult.
Shannon Carr. Is that you? Is that you? Yes? Yes.
Doctors hope the drug baclofen will relax Shannon's muscles if it can be injected directly into her spinal fluid. Today, Shannon begins a series of test injections through a catheter that has been inserted into her spine.
How will you be able to tell if it works?
If testing goes well, a pump will be surgically implanted into Shannon to deliver continuous medication, and the quality of her life could be significantly improved.
Shannon has cerebral palsy, and as many children with cerebral palsy, she's got a lot of spasticity in virtually all her muscles, but worse in some than others. And she's been tried on the drug baclofen, which relaxes the muscles and acts on the nervous system, but when you give it into the stomach, its major side effect is sedation. The idea with putting it into the spinal fluid is that you get a very high concentration just around the spinal cord where you want it to act. But we don't know that for sure it'll work, so that's why we're doing the test dose. So we've put half of the catheter in that we'll eventually use, but we're giving her 3 test doses.
Okay.
And that should tell us whether or not it's going to help. Okay. Well, Dad's going to hold your hand, okay?
No.
He's going to hold your hand, and we're just going to...
Nothing's hurting.
Nothing's going to hurt, sweetie. We're just going to find your little injection port here, okay?
Okay. See there. Look.
There we go.
It's okay.
No, I don't think it allows you to withdraw. Nothing to worry about. This isn't going to hurt at all, sweetie. Shannon, it's okay, sweetie.
Just looking at the little, at your band-aid.
Just look at your band-aid.
That's good.
Just gonna put the band-aid.
That's it. We're done.
They're all done, see? Thank you.
Like you're going to feel very relaxed in about 20 minutes, okay?
You did good.
There you go. There you go. Okay.
Now,
There.
that pillow, Liam, that one. That one for your head. Say.
Lots of kisses, huh?
$86 centimeters.
Okay.
Okay, Mama, you know what? Sit back, and we're gonna put this seat back. That's perfect. Okay, up to your face.
Okay, Peanut, we're gonna take a look.
Okay, baby.
I know. Oh,
okay.
sweetie.
It's okay.
Yeah. You hold my hand. You hold my hand. Okay, Peanut. Here we go. Sweetie pie.
Oh, good girl. Oh, excellent job.
Okay, so almost done. Almost done. Okay.
Mama, lots of pressure. Okay, don't be afraid to press, okay?
Yeah. Okay, so yeah. You want?
Oh, Mama.
Well, how's she doing?
She's a bit agitated for the first half hour after the. She was, crying a little bit, and she's been pretty dozy ever since she got.
Okay. So look at your legs, okay there, Shannon? That's a girl.
Okay.
There you go.
That's a girl. There we go. That's a girl. Let me just feel your legs, okay? That's a girl.
That one's probably
That
still
one's
a
not.
little bit.
Yeah,
Not quite.
it is. It's not quite as relaxed as the
Not
one.
quite as well.
I still think we'll give her another test injection.
She still could get sick, right, from
Yeah,
this? a
because
bit?
that's what happened last night, right?
Yes.
She vomited later,
About
so
an
let's
hour
just,
after.
yeah, okay, maybe a little bit more. We'll just see how she tolerates this one.
And she had some medication upstairs.
Okay.
It's just to make her drowsy.
Yeah, she did.
Yeah?
Yeah.
Look at those.
What are you making? Tea? Are you making tea? All right. Okay. Do you want to give her a hug before we go?
Okay.
Let's go for a walk.
Okay.
Okay, here.
You ready for nature day?
That's a girl, Sharon. Let's just see. So she's responded as we would predict, and
Right.
the drug wears off, she goes back to the way she was. So that's
Right.
all the signs that she should do very well with the pump.
When you put the pump in, it won't affect, like when she's sitting, her ribs or anything?
No, we'll try and place it midway between her rib cage and her hip bone
when
here,
she's
so she
sitting.
sits. It shouldn't.
Okay, will it be as painful for her? Will that one be a little painful?
It might be a little bit more painful
Then
the
what?
first day or so, but
She'll get the backup in as soon as the pump goes in.
yeah, we'll fill the pump, but we're going to start her off in a fairly low dose because
Yeah.
we're just giving her one shot here and then it wears off, and the pump will continue to infuse it.
Okay.
That's the atrium we're opening, and that's our window to the heart. This is the patch we're putting in to close the hole. Normal pulmonary valves have 3 leaflets. In this case, there are only 2, which is usually what happens with tetralogy. And we just have to see whether or not we can rehabilitate this valve and make it work for her, which would be ideal.
Dad, are you coming in again? I will, yeah, if you don't mind. Right,
He's a
okay.
little under the weather. Does that
Yeah.
matter?
Well,
As long as
depends.
he's covered up?
Yeah, as long as he's not gonna, you're gonna be okay yourself. Yeah, right, yeah, that's all right. Great. Okay.
Like it? Be sick looking, eh? It's all over now, Sheila. It's almost over. Okay?
think I'm going to use just some pericardium. Did you open it, Dorothy?
No.
Mosquito. Okay. One?
Thanks, Karen.
Hello. Everything seems to be okay, and the heart seems to be working well.
心脏功能非常好。
We closed the hole in the heart, and then we worked on the pulmonary valve to make it bigger, and also the pulmonary artery on the left side was a little bit small, so we made that a bit bigger as well. She's asleep now. We'll wake her up in a few hours and take the breathing tube out in a few hours.
一共身上得有几个管子？
How many tubes does she have now?
Lots of tubes.
Will there be like special care that we need to do for her?
Well, she'll be in the intensive care unit
Yeah.
for 1 or 2 days, and she
Okay.
goes to the floor,
Uh-huh.
and there it's just a matter of controlling her pain and getting her to where she can eat.
Good. Thank you very much.
You're welcome.
Thank you
You're
very
welcome.
much.
Yeah,
We'll
thank
see you.
you. You should touch her hands. Just make some harm, okay? You can touch her. She's got this JPN, and that's draining some blood. And she can hear you, you know, even though she's on all these drugs that are sedation, she can still hear you. Susan, are you okay? It's done.
You all set?
See you later. Just undo that, Glenn. No doubt, just gonna put a little bit of muscle.
Karen, we can probably get the pump out now, eh? Okay. So Karen has to program it. Okay, that's good. So now we're just creating the pocket for the pump, and we're going to place it under the outer layer of fibrous tissue that protects the abdomen. And because she's so thin, the pump will sit very high, and we're just starting to create that pocket now. The pump has to be sitting absolutely perfectly without kinking the catheter. Then we have to suture it in place so it can't move. And it has to be absolutely perfect or it won't work. So now we're just injecting the baclofen into the pump, and we're only going to half fill it for the first dose, just so we don't overpressurize it. I think the pump is going to want to kind of sit like that, and we're going to coil it around like that. So in goes the pump, like that. That's sitting very nicely. This is like the hardest part of the whole operation right here. So there's a point of no return.
Okay, we gotta save that piece too, right?
Give me the sleeve. And just give me the padded forceps.
Your mobile out of the way here. There. Is that better? Is that what you want? Here. Okay. You need your hose though. Where? Oh no. Okay. That's better.
So everything went fine.
So you got pumping okay?
Yeah.
Because she's so skinny and all, but
Well, looks good. We were able to get it underneath the wall of the tummy, so that should make it so it doesn't stick out too much for her, but still be easy to fill. It's a bit more painful than just sliding underneath the skin.
right.
So we're gonna give her some morphine,
Oh,
just
you are?
for
Okay,
a couple of
day or
days.
two.
Yeah.
Okay.
Just make sure she's comfortable.
So she's going to be in some pain then?
Yeah, this is gonna hurt a little bit. And I don't think her back will bother her now, but I think her tummy will be sore for a day or so.
Okay.
Okay. Okay.
Okay, you're okay, Shan. It's all right. It's all finished now.
All done,
It's
Shannon.
all finished.
Here, sweetheart. Here's
All
Teddy.
finished.
Look, Teddy's here with you.
Take a seat. Okay?
Okay, so what I have to do is I have to find which wire comes out and which wire goes in. Okay, so I'm just going to use this to help me. I can cut it right there. Okay, that one's half done. Okay, now this is the part where I have to take the wire out, okay? So you can tell her she takes big breaths, it really helps it come out, okay? That's good. It's almost done. Okay, here we go. A little more. Okay, may your left. There. It's done. It's done. You can wipe it.
Would she like a Band-Aid?
Yeah, I think so.
Yeah?
Okay, Danisha. I think she's scared. Like she's okay, it's okay. There you go. There.
Yes,
Okay.
to cover it, of
Okay.
course. Of course. Yes. Let's make it all better.
You're afraid to look at that, huh?
All better?
Okay, say thank you. Thank you. It's okay. Okay. Mela.
Can you shake my hand?
Now,
Okay,
here we
now
go.
we're gonna go. That's the girl. Oh, you're nice and loose up here.
That one's nice and loose. And it's okay, I just want this arm out so we can see what this one's getting there.
Okay. All right, Shannon. Well, listen, I think we're gonna turn you up one more notch, okay?
Turn her up a notch. What
Yeah.
do you think, Faye?
So Shannon, I've done very well from the medication, and already I think she's significantly looser, mostly in her upper limbs rather than her legs, but I think her legs are a little bit better.
See?
Yeah.
All right.
So these are all very positive signs, and we're still at a fairly low dose. We're just going up slowly. So once she gets to the Hugh McMillan Center, then they'll continue to increase the dose. They'll just make sure that she gets right back to her full baseline before she goes home. You should be a politician.
Yeah,
changes.
could make some changes, eh? That's good. Yeah, I think she's doing really good. She's happy because she's not in pain.
Come on in with Susie.
Let's go.
There's basically not much, if any, narrowing left there at all. Occasionally, some of these children will develop a recurrent narrowing, and some of them will develop heart rhythm problems, either from the top or the bottom chamber. But the majority of them, 80 to 85% of them, do well throughout. Okay? Let's have a quick look at her. She seems to be happy when we're listening to her.
Yeah.
And we're all done.
Okay. All done. Can you say thank
You know that
you?
one, huh? The nurse's teeth taught you that one.
Yeah.
Susan has now recovered from surgery, and her heart function has improved.
Everybody have fun, guys. Thanks.
She will remain in Toronto for several weeks, so doctors can ensure she continues to do well before she returns home to China.
Wow, all dressed in purple too.
Yeah.
You look great.
Look, show Dr. Failing. Come on, look.
Oh,
show.
very nice. You're starting to get some relaxation over there too.
Yeah.
Excellent. Shannon, what I'd like to do is I'm going to plug my programmer in here, and I would just like to scan your pump and see what it's reading. Okay. Let's see what it says. It says you've got 8 cc's in your pump. Yeah, your parents are on top of things. 200 mics. They had the right answer.
And we passed.
Other thing we're going to do is we're going to try to get you home as soon as possible. Okay? Because I know that would be nice too.
You want to go home? Feeling good? Okay, feeling good?
Now that Shannon has a baclofen pump to deliver her medication, her rigidity and spasticity have been greatly reduced.
Sit down. Sit. Tell him off. Look at you. You hugged your first hugs. You haven't been able to give hugs before, have you? But now you can. Now all you want is hugs.
She can now enjoy movement without pain, and doctors hope to see even more improvement for Shannon in the future. On the next episode of Life's Little Miracles, Cameron's cleft lip, and Norman faces cancer.